Cases with dual diagnosis about 69%, and this confirms that such kind of cases are more risky to commit suicide, to commit crimes. 21% of the offenders were amphetamine abusers, and there was a very high ratio. This is a very high ratio, and it is due to wide prevalence of several types of amphetamine there, and very cheap for the price. One tablet of the amphetamine is about $2 to $3. Even the type of crimes of amphetamine users were logically related to the substance, mostly violent crimes, 4 cases murder from amphetamine. %58% of cases have been in contact with mental health system and lost contact within weeks in 9 cases, as I told you, and all of them substance abuse. 32% of cases had history of similar offense. There in Kingdom of Saudi Arabia, up till now still, we don't have mental health act. So we cannot admit the patient voluntarily or involuntarily. It is a decision hard there to take. Because psychiatrist, if he takes the decision, he may be sued or subjected to investigation in the Ministry of Health. And it is a problem, absence of the Mental Health Act. 4 cases of amphetamine abuse between the 14 cases of murder, previously admitted to addiction units in the same hospital I worked there, and 2 of them discharged within 2 months of the crime. 2 months of the crime, 2 of the murder was between them. This fact raised a very important ethical concern, how to prevent violence due to use of amphetamine in such a region, especially the amphetamine is widely available there in all the Persian Gulf region. And just the discharge of the amphetamine abuser from the hospital, it means they will take again, and once he will commit crimes. Also, this study confirms that the ability of the mental health care system to prevent crimes due to substance abuse is very limited. The ability of the legal system to predict cases was good. The ability of the health care system to predict crimes and offenses was weak. Substance abuse, especially amphetamine, played an important role in the crimes there. More research is needed to further our understanding of the association between mental disorders and the antisocial behavior. I will present for you some of the obstacles we face there during work in this forensic committee. Cases presented to the Forensic Psychiatric Committee are not the regular cases elsewhere, as the setting is completely different. Some patients exaggerate their symptoms. Others may faint or claim symptoms. Even the relatives of the patient are not honest, and they have conflict of interest and uncooperative in giving details about the patient. So working in forensic psychiatry is extremely difficult, as all sources of data are questionable. And data are very poor, and usually persons come to psychiatric assessment after many weeks from the crime itself. So it is a very hard work. Interview with such cases take long time and may be prolonged for hours, and the diagnosis may take frequent visits and may not be achieved at all. 7 of the cases referred to other committees. Recipients of such reports have no knowledge about psychiatry. This is a problem in all the Middle East countries. The people working in the legal system don't have an idea about psychiatry. So they need a lot of explanation about the report and what is written inside. In some cases, the judge asked for further assessment or more assessment, or refer by himself to another psychiatric forensic committee.
Well, first of all, thank you so very much for this very, very important study in your country. And really, you are a pioneer, and you're doing very, very important work that really has to be done. And congratulations again, and please, another round of applause. I want to open up for questions now. Yes, please.
So I wonder, is Saudi law or Sharia law, or does Sharia law recognize diminished responsibility due to mental incapacity?
Diminished responsibility. Yes. Yes. Some of the cases, diminished responsibility. For example, some of the personality disorders, some of the neurotic disorders, we give them decision, diminished responsibility.
Yes, sir.
I was surprised to see the relatively high rate of amphetamine abuse in that population, because here in the West there's a perception that penalties for amphetamine use and other drug use are relatively more severe than they are here in the West. Is that correct?
Actually, we have a very large problem with the amphetamine there. The amphetamine there is called captagon.
Exciting talk. I'm very pleased that another colleague from a country in our region is doing this work. I work in Egypt, where we face very similar situations. I just want to point out 2 points very quickly. You mentioned that you don't have a mental health act in Saudi Arabia, but I think what would really make a difference to your colleague in forensic psychiatry, in protecting them as well in future years, it wouldn't be a mental health act, but it would be a guideline, a sort of good practice guideline for forensic psychiatry in the kingdom. And that's an easier thing to do than to pass a mental health act. Our new mental health act...
How many people denied the crime they were suspected from, and how do you report about these people?
Actually, I do not remember how many of them denied, actually. But, for example, most of the psychotic patients did not deny the crime, for example. But I have no percentage now.
It makes it more difficult to report about these people when they deny their crime?
No, it is not difficult. Not difficult.
He is not referred, they are not asking us, their psychiatrist, if the patient denied or not. They are asking about his mental status. We are not concerned about his denial or his actual society.
Any more questions? We have 2 more minutes. Last chance. Yes, please.
Are there forensic psychiatry residency programs in both Saudi Arabia and Egypt?
We don't have subspecialty in all subspecialty. We don't have training specific for or give a certificate for subspecialty, either in Egypt or in Saudi Arabia. Still, we have only general psychiatry training program. Thank you very much.